If your blood pressure is too high, you're at an increased risk for a stroke or a heart attack. Atenolol is a medication to help treat chest pain and manage your hypertension. In this video, we'll look at the medication, atenolol, and 14 tips in dealing with this medication. Coming up. I'm Dr. John, board certified in internal medicine as well as geriatric medicine. This channel will give you tips and advice to promote your health and to keep you young. What is atenolol? Atenolol is a medication used to treat high blood pressure. It can also be used to treat chest pain, also known as angina, and irregular heart rate, and is used in the early treatment after a heart attack. It is also used off-label to treat migraines. It can be also used off-label to treat a thyroid emergency called thyrotoxicosis. It belongs to a family of medications called beta blockers. The brand name for atenolol is Tenormin. How does atenolol work? Like other beta blockers, atenolol works by slowing down your heart rate and making it easier for your heart to pump blood around your body. Atenolol does this by changing the way your body responds to some nerve impulses. Atenolol dosing and administration. Usually, atenolol is taken orally once a day. You can take this medication with or without food. The doses in its tablet form is as follows: 25 milligrams, 50 milligrams, and 100 milligrams. You should start the dose at the lowest dose, especially if you're older, and if need be, increase the dose weekly based on your tolerability of the medication, the side effect profile, as well as the dose response from the medication. It's okay to take the medication at nighttime as long as you're taking it at the same time every day. The starting dose of this medication depends on what pathology your healthcare provider is treating. If they're treating angina, chest pain, some providers start at a higher dose of 50 milligrams for symptom management. The starting dose for both high blood pressure and atrial fibrillation is usually at 25 milligrams. If you use atenolol as a blood pressure medication, it is recommended another treatable comorbidity such as heart attack or history of heart attack is also being managed. If you're interested in other blood pressure medications, click right here. Number one, this drug is going to lower your blood pressure and lower your heart rate. This might make you feel dizzy when you suddenly get up. Take your time when you're getting up, especially from a sitting position. Be careful going up and down stairs. Number two, atenolol can affect your blood sugars. If you are diabetic, continue to carefully monitor your blood sugars as it can cause low blood sugars. Symptoms of low blood sugar are fast heart rate, dizziness, sweating, and feeling shaky. Number three, atenolol can cause bronchospasms. Symptoms would be difficulty breathing and wheezing. Although because of the way atenolol works, it works over a beta-1 receptor, the chance of this happening is less likely. However, if you have bronchospastic disease such as asthma, you would be more susceptible to this. Tell your healthcare provider if you do have increasing cough, wheezing, or shortness of breath. Number four, beta blockers such as atenolol do have central nervous system effects. They can cause fatigue, insomnia, and in some cases sleep disturbances. This is because beta blockers slow down your heart rate and you'll feel more tired as your heart rate slows down. Because of this, you may want to take your first doses of atenolol at nighttime as it can make you feel sleepy. Once you're used to the medication, you can switch to the morning with the help of your healthcare provider. Number five, avoid drinking alcohol while taking this medication. Number six, this drug has been associated in the worsening of psoriasis. If you have any of these changes, alert your healthcare provider. If you're finding value in this video, don't forget to like, subscribe, as this really helps this channel out. Number seven, erectile dysfunction has been described with this drug in post-marketing surveys. This is because atenolol can block activity in parts of your sympathetic nervous system. Follow up with your healthcare provider if this is the case to rule out other causes. Number eight, in less than 3 to 4% of cases, it can cause GI symptoms such as diarrhea and nausea. These are usually self-limiting and should go away. Number nine, beta blockers such as atenolol are selective beta blockers. Your healthcare provider must be cautious in severe peripheral vascular disease as it can cause lower extremity pain. If you do have increased leg pain while walking, alert your healthcare provider to this. Number 10, in acute exacerbation of heart failure, your healthcare provider should not use beta blockers. He or she can reintroduce the medication once your heart failure is compensated. Number 11, Never suddenly stop this medication without talking to your healthcare provider, especially at higher doses, as it can cause an increase in your blood pressure and an elevated heart rate. Number 12, if you do take this medication with another family of medications called calcium channel blockers, such as verapamil or diltiazem, there is an increased chance of slowing down your heart rate and an increased chance of a heart block. Your healthcare provider will have to monitor your heart rate with EKGs. Number 13, this medication should not be given to patients with untreated pheochromocytoma. Pheochromocytoma is a rare type of neuroendocrine tumor. Number 14, Atenolol can also mask the symptoms of an overactive thyroid. This is also called hyperthyroidism. If you do have this, do not suddenly stop the medication, as it can cause a life-threatening condition called thyroid storm. Number 15, here are the most common side effects associated with this medication. This list is by no means exhaustive, and talk to your healthcare provider if you're experiencing any other symptoms. Orthostatic hypotension, GI side effects such as nausea and diarrhea, fatigue, dizziness, depression, limb pain, slow heart rate, cold extremities. Drug-drug interactions. Atenolol can interact with some of these medications. This list is by no means exhaustive, but your doctor or your pharmacist can alert you to possible drug-drug interactions. These medications are amiodarone, clonidine, verapamil, diltiazem, albuterol, or digoxin. And if you're interested in the side effects of other medications, click right here or click right here. Have a good day and think your health. Why am I doing so badly? What the heck's going on? Verapamil.